The month of December usually is very stressful for me. During the holidays, I tend to have almost zero time for myself. I usually like to get a proper massage from a massage therapist every other week to decrease tension in my scalp, neck, and shoulders. With almost zero time left during the holidays, I have discovered something that has helped me tremendously with my stress relief. That brings me to today's sponsor. Breo's portable massagers are one of the best in personal health and everything that you need in regards to relaxation. When I'm stressed, I usually tend to lose a lot of hair and I see dandruff, especially on my clothes, on the shoulders. I've noticed that since using the Breo scalp massager, there is definitely less hair falling off. I can see it on my hairbrush, which is amazing. You can either use essential oils, you can insert them right here, or you can use any kind of treatment that helps with dandruff, itchy scalp, or hair growth. And that has really helped me a lot to de-stress, usually in the shower. If it's, hot water, it helps with vasodilation and hair growth. Since I don't have a lot of time during the holidays and I can get a massage from an actual person, I have found the scalp massager to mimic exactly the hands of a trained massage therapist. It is a very good companion on the road. You can take it with you on the plane. You can put it in a very small purse, and I just take it with me now everywhere I go. I love using it in the office as well. It is very silent, so that's really good whenever you don't want to bother your partner or your coworkers. And trust me, nobody will think that you're weird. You're just taking care of yourself. Since it has a waterproof design, it is very easy to clean, and we all know how, things can get messy. So I usually like to wash it in the shower. When I use it on my scalp, it already has a lot of foam, and then I just rinse it with water. You guys also know that I have a lot of neck and shoulder pain. It's mainly based on the fact that I have TMJ and I tend to tense these muscles a lot, especially when I'm stressed. Since we can't get a proper massage from a real person, I have found this deep tissue neck massager to be almost as similar as the massage techniques of therapists. Now, if you love these products and you would like to give them a try, go ahead and use the link in the video description. Usually these promotions help my channel a lot, and we are able to use the resources to grow our audience and make sure that we are reaching lots of people who use ASMR on a daily basis to relax and de-stress. Thank you, Breo, for sponsoring today's video. And thank you for watching.
I'm going to go ahead and put gloves on, and then I'll take a look at your back. You mentioned you're having some neck pain, and it's going down the spine. Is it okay if I put your hair up so I can take a look at the back of your neck? Okay. palpating to see exactly what grade you are. Palpating cervical spine, C1 and C2. Feeling the curvature. Any pain when I'm palpating right here?
No.
So the pain is mainly on the lateral sides, correct?
Mm-hmm.
Okay. I'm definitely noticing some muscle tension going all the way down to C4 laterally and C5 left. Moving down to the thoracic area. Some swelling here. More swollen on the right side. Okay. Contracture and spasms on the right side. There you go. Okay. Okay, nerve pain referred on the right side. Spasmodic interference. Moving down to the thoracic area. And we're checking mobility. And so any deviations of the spine, left or right. And it does start at T2 to T3. Somewhere in between there. A slight curvature. 3 to 5 degrees to the right. Are you having any pain when I'm palpating?
Mm-hmm, a little.
Okay. Is that what you always experience, or is it just now?
Always.
Okay. palpating scapula, slight elevation on the right side compared with the left. Okay. I'm going to take measurements. I want to see exactly what the angle is and how much asymmetry is. Starting with the shoulders. We definitely want to treat you today. Make sure that we increase that flexibility of the spine. Okay. Angles about 10 degrees. Inflammation mainly on the right upper side. Mild to severe scoliosis. I'll take one more measurement and then we'll be able to say exactly what percentage we can fix today. Okay, this is going to feel a little bit cold and pointy. I'm going to tap on the bony prominences of the vertebrae. Let me know if you feel any kind of pain. We're looking for spasms that would be elicited just by the simple tapping. Any pain there?
A little.
It does seem like there is a lot of pain on the middle part, and it could be caused by the deviation of the spine. What we can do today is to increase some of that circulation. First, we're going to do a few tests. I'm going to look at how the muscles react. Slight inflammation. Overall, there's good circulation in the area. I'm not noticing any redness. Okay, I'm going to do a test. I'm going to touch you with 2 or 1 pressure point. This is what 2 is going to feel like, and this is what 1 is going to feel like. Go ahead and tell me if you feel 2 or 1, okay?
2, 1, 1, 2, 1, 1, 2, 1, 1, 1, 2, 1, 2, 2.
Okay. And I'm going to touch you with a puff of air. Go ahead and tell me if you feel this on the left or right.
The right. Okay. Left. The right. Right. Left.
Right. Right.
Okay. Can you please tell me if this feels cold or warm? Does that feel cold or warm?
Cold.
Okay. What about now?
Cold.
Okay. Is this warmer than the last touch? And is this the same touch as on the right side?
Mm-hmm.
Okay. Does this feel cold or warm?
Cold.
Okay. And now, does this feel cold or
Cold.
warm? Okay. What about now?
Warm.
And now?
Warm.
Okay. Go ahead and tell me when you don't feel the vibration anymore, okay?
Okay.
So you can just say now.
No.
What?
No.
Okay. Slight delay there.
No. 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 No.
Okay. I'm going to touch you with a different texture now. One is going to feel sharp, the other one is going to be dull. I'm going to need you to tell me if it feels sharp or dull.
Sure. Sure. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. Sharp.
Okay. Alright, we're going to go ahead and warm up the muscles first. I'm going to apply some cold therapy to increase circulation in that area. To feel that, we can go ahead and work on the muscles and increase pressure as we go. So this is going to feel a little bit warm. This is anti-inflammatory oil. And I'm going to mainly apply it on the areas where I'm going to be working. Definitely focusing on the right upper side and middle where you're having more pain. We want to move some of the ligaments and increase circulation in that area. A mild case of fibromyalgia. I'm definitely going to increase the muscle relaxant strategies that we're going to apply today to desensitize the muscles and the fibers. This is going to feel a little bit cold. What it does, it applies multiple pressure points, working on the paraspinal muscles, moving outward laterally. So just using a circular motion. I'm going to increase pressure as I'm pressing down. Let me know when it gets too much, okay?
Mm-hmm. That's good.
I'm going to work on the lymphatic drainage as well, so I'm going to use the shoulders first. Just slowly massage the lymph nodes that we have in this area right here. I did notice that the right side is a little bit more swollen, indicating more fluid buildup. So this will definitely help to decrease some of that inflammation and puffiness. Sorry. Working on the paraspinal muscles. Also, I'm going to apply some pressure points therapy on the lateral side of thoracic area. This helps to desensitize and target the main pressure points. Okay, I'm going to do a slight adjustment. So I definitely want to see this shoulder coming a little bit down, and I can see that you're carrying a lot of weight on this right upper side. Okay, we're going to use breathing to help facilitate some of those muscles and make sure that we're moving them in the right direction. Okay, I'm going to have you take a deep breath in. Okay, 1, 2, 3, and slight pressure here. Very good. And we'll do the same thing again. Take a deep breath in and breathe out. Very good.